But the economy is definitely going to be in the crapper for the next 3 or 4, maybe more years, maybe 6 years. It's going to be a different situation. But at the same time, you've got people who are actually going to pay for that calculation. I mean, we're in a dilemma not unlike the Red Sox for many years. Red Sox would never have a rebuilding year. So they'd always get into the pennant race. And it would keep the fans happy, but they would never get all the way. And that is sort of the dilemma we have. I don't have the answer. But I heard this, in terms of the implications of what a President Perry would be, let me just give you an example. This story from ABC, a 24-year-old Cincinnati father. I think the guy had twins. 24-year-old Cincinnati father died from a tooth infection.
I heard about this.
Because he couldn't afford his medication. I guess it started where this guy, Kyle Willis's wisdom tooth, started hurting 3 or 4 weeks ago. Dentist told him it needed to be pulled, and he decided to forego the procedure because he was unemployed and had no health insurance. When his face started to swell and his head began to ache, which of course is a sign that you've got an infection and it's starting to spread, he went to the emergency room. He received prescriptions for antibiotics and pain medications. The guy couldn't afford both, and so he chose the pain medications. The tooth infection spread, causing his brain to swell. He died last week. And, this is not the first of these stories. It was a couple of years ago. It was a 12-year-old kid who had the exact same situation, or more or less. He went through a couple of weeks of hospitalization. I can't remember how he paid for it, but his parents didn't have health insurance. They couldn't afford the $80 extraction to pull out his tooth, or they didn't go to see a doctor because they didn't have insurance. They had lost his Medicaid benefits, and he couldn't afford the dental surgery, so the 12-year-old kid died. Kaiser Family Foundation reports that 33% of people surveyed in April skipped dental care or dental checkups because they couldn't afford them. A 2003 report by the U.S. Surgeon General found that 108 million Americans had no dental insurance, nearly 2.5 times the number who had no health insurance. That number is probably higher today. And the Affordable Care Act is actually going to help people like this, assuming it's intact by the time we get to 2014. An August report by the Commonwealth found that 72% of people who lost their health insurance when they lost their jobs said they skipped needed health care or did not fill prescriptions because of cost. People want to believe there's a safety net that catches all of these people. Well, there isn't, says Dr. Glenn Stream, president-elect of the American Academy of Family Pediatricians. The Affordable Care Act will not deal with all of this, but it will deal with much of this. If you have President Perry, you're almost sure to have the Affordable Care Act go away. So when you make this determination, and it's not, look, your determination may or may not impact the election whatsoever, one way or another. But when you make this determination, understand the calculation that you're making. More people will die.